It is generally believed that good health is often underrated and one only gets to appreciate it the more during sickness. Although people generally pray for good and perfect health condition, however, not everyone is lucky enough to enjoy perfect health till old age.
To check yourself, know your health status, because if you are not healthy, there's no way you can even be efficient in what you are doing.
Across the bar of 50 years, I'm in my 60s, is very necessary. There are certain elements that just crop up. Whether you like it or not, it just come up. So there's a need for one to be conscious of his health, because if you don't take care at this first stage, later it culminates into something bigger.
While some are always intentional about how they treat their health, especially by imbibing positive lifestyle changes, some others believe that something must always kill a man, no matter how careful one is. One of the factors that often change the calculations of people in terms of health projections is the outbreak of any kind of diseases or infections. This becomes more prominent, especially if such a disease is highly contagious and has no known cure, just as it happened during the early outbreak of COVID-19 before vaccines were finally discovered.
Since the beginning of the pandemic in the year 2019, we'll be having COVID-19 with us, and we used to tell people that it's not going away anytime from now. But the best thing and the plus to our government that we have vaccines that are readily available and they are free, and there's no government health facility, especially public health centers in our state that you go to, especially the focal ones that you go to, you will not be able to get these vaccines.
The global community is yet to fully recover from the havoc caused during the outbreak of the highly contagious and deadly COVID-19 disease, with the resurgence of variants and its attendant implications on the socio-economic life of the people. Nigeria as a country had battled diseases such as COVID-19, Ebola, and Lassa fever, which is still affecting some states of the Federation. However, another contagious infection known as diphtheria has emerged and has been spreading in some parts of the country. Diphtheria is said to be a highly contagious disease caused by a bacterium called Corynebacterium Diphtharia, which produces toxins that makes people very sick. Explaining more about the disease, an epidemiologist who doubles as the head of Department Community Medicine, Union Osun Teaching Hospital, Osogbo, Dr. Kunle Salami, stated that diphtheria spreads from person to person, usually through respiratory droplets from coughing or sneezing, adding that people can also get sick from touching infected clothes, objects, or open sores.
It's a bacterial disease that is not very common. In fact, there are generations of doctors or health workers generally that have not seen cases of diphtheria in their life. But simply put, diphtheria is a bacterial infection that affects the respiratory system, most especially the nose, the larynx, the pharynx. So we can have what they call pharyngitis, laryngitis, and so on and so forth, and tonsillitis as differentials of diphtheria. But how do you make when somebody is coughing and somebody is having difficulties in swallowing? Those are the symptoms anyway. But there is what we call gray patches at the back of the throat. So the health workers should please watch out for diphtheria outbreak.
The medical practitioner identified the symptoms of diphtheria to include fever, runny nose, conjunctivitis, and neck swelling. He warned that those who are at risk of contracting the disease are children and adults who have not received any single dose of the normal childhood routine immunization, or those who did not complete their dosage, people who live with poor sanitary conditions, healthcare workers, or those exposed to cases of the disease.
People who have poor immunization history, they should please go and get the vaccine. Then one other thing is to prevent overcrowding, and at the same time, standard of living needs to be improved.
It will be recalled that the data released by the Nigeria Center for Disease Control (NCDC) shows that the country has a total of 123 confirmed cases of diphtheria infection and 38 deaths in 4 states of the Federation. The agency noted that Kano has confirmed 100 cases, Lagos 5, Yobe 17, and Osun recorded a single case. Oluchi Amuda, OSBC News.